Hi, my name is Monique. This is my blood administration video for 366. So, um, before doing so, I would like to make sure that I have the right patient by using two identifiers, which is the patient has verbalized her name and date of birth, and I have checked against the wristband. I also want to make sure that I have the patient's consent along with requisition and compatibility. I would like to make sure that I have a second nurse to verify the patient's identification, along with the blood identification number, the blood type, the RH group, expiration, and the blood donor's number. So then I will perform hand hygiene, and I will don my gloves. Next, I am going to use the Y tubing that has a blood filter and get my saline going. So I'm going to make sure that all of these clamps are closed. This is the first one, closed. This is for blood, so this one will remain closed until I use the blood. And this is for saline. So I am going to prime this, spike the tubing and prime it. I'm going to make sure that it's hanging 36 inches above the patient. So I am going to begin priming the chamber. And then I am going to make sure that the line is primed as well. Can you see? All right. And I'm going to slow it. There are no air bubbles. So the saline is primed. This is the blood. So I'm going to invert the blood to make sure that the cells are mixing. So now I am going to spike this and make sure that the clamps are closed still. Making sure that this remains sterile. And now I am going to hang the bag. I'm sorry, it's hanging. So I have the clamps closed. I'm going to open this. I still have this side closed. So the blood has gone all the way down the line, and I'm going to stay with the patient and observe for the first 15 minutes. I'm going to assess the patient for chills, for rash, for nauseation, and vomiting, tachycardia, and hives. This needs to be done to determine if the patient is having an allergic reaction, because blood is it can be deadly if not paid attention to, or if the patient is having a reaction. And so the blood has spilled out, not spilled out, but start the transfusion. All right, thank you.